Has your child been to countless doctor appointments, had multiple rounds of blood work, maybe even MRIs or expensive tests, yet you still don't have real answers about what's causing their chronic health struggles? You're told everything looks normal on their labs, but your child is still dealing with sleep issues, digestive problems, behavioral challenges, or developmental delays. Meanwhile, your pediatrician keeps saying they'll grow out of it or offers another medication to manage the signs. But what if I told you there's a crucial exam that reveals the root cause of your child's health challenges, one that most doctors never perform? An assessment that can detect the hidden dysfunction that traditional medicine completely misses. Yet it's completely safe and non invasive for children as young as 1 day old. This video is for exhausted parents who've tried everything from diet changes to supplements, therapies to medications, but still don't have answers about what's really causing their child's chronic health issues and are ready to look deeper than the signs. We're diving into this revolutionary insight scanning technology that assesses your child's nervous system function, the air traffic control of the entire body. You'll discover why this exam is more valuable than traditional blood work or imaging and how it reveals the true root cause of chronic illness that other approaches miss completely. So here's a staggering reality that should concern every parent. Traditional medicine relies primarily on the signs and looks for obvious pathology on standard exams like blood work, MRIs, EEGs. Yet these tests often come back normal, even when children are clearly struggling with significant health challenges. What's missing from this approach is an assessment of the most critical system that determines whether your child is healthy or not, the central nervous system. Dr. Bruce Lipton, a renowned cell biologist, puts it perfectly. The function of the nervous system is to perceive the environment and coordinate the function of all other cells. This means while you've probably invested considerable time, energy, and resources trying to improve your child's gut health, immune system, and motor development through various therapies, most healthcare providers have completely overlooked the one common thread that ties them all together: the nervous system itself. The central nervous system, it serves as that air traffic control for your child's entire body, coordinating every internal function with every movement, thought, emotion, behavior, and cognitive process, making it the most important system to assess. While traditional medicine it chases the signs and movement-based therapies assess muscle tone, we go deeper. We as pediatric chiropractors evaluate nervous system function through this advanced scanning technology. Your child brain, it doubles in size during the first year of life and continues rapid development, making nervous system assessment during this critical period far more important than knowing where they are and where they sit on a height and weight chart. So I want to walk you through these three scans and explain why they're so key in helping your child. The first scan that we're going to cover is the neurothermal scan. It's a temperature scan, thermography, and it helps to identify what we call regional effects of subluxation and dysautonomia, which can affect your child's digestive system, immune function, hormones, and sleep regulation. These functions are supposed to run on autopilot. This explains conditions like colic, reflux, constipation, chronic ear infections, and allergies that traditional medicine cares for, as separate, unrelated issues. If the autonomic nervous system, you can think of it as the autonomic nervous system. If this is stuck, then we're going to struggle. Our kids will struggle with these more basic functions of life that are supposed to work well without any help. Now, the second scan I want to cover that we run is what we call a neurospinal EMG scan, which measures the neuromotor system or movement system of the body. This scan, it is vital for investigating like conditions like autism, sensory processing disorder, ADHD, and anxiety. We can detect three key patterns that we see with the scan, what we call raging bull, which is seen, in hyperactive and anxious children. It's a child who's on and doesn't seem to turn off. They're go, go, go. The drunken bull pattern is when a child is, just dealing with coordination and focus challenges. Their sensory system isn't perceiving things as it could or should. And the third pattern is the raging drunken bull, which is simply a combination of both previous patterns. A kiddo who is uncoordinated and also will run into the wall because they're so wound up with energy. This scan, it shows us specifically how well the body is coordinating movement and energy and how it's perceiving its internal environment. Essentially, it's how the body is communicating to the nervous system. Is it calming and sending good information, or is it confusing and dysregulated? All right. The third scan I want to cover is what's called heart rate variability. This assesses your child's adaptability and resiliency, revealing whether their nervous system is healthy and balanced or stuck in chronic stress mode. It's like measuring their body's battery or their ability to handle stress. It's a key marker that determines if they can properly adapt to, daily physical, emotional, or environmental challenges. And so we want to see what a child's nervous system is like in our office in a calm and relaxed state. If it's not and their system is more stressed, then the marker will tell us essentially, hey, we're probably going to struggle with some things. And that can look like a host of different challenges, symptoms, and diagnoses because the nervous system at the root of those things is stressed from a global standpoint. Now, these scans explain a lot of what traditional medicine can't because they look deeper. They look at subluxation, they look at dysautonomia, the real root causes creating those major problems in your child's nervous system. When we look at that EMG scan, for instance, we can see stuck stress and tension, lack of balance and coordination, and overall disorganization and dysfunction, which then can manifest as symptoms like a child with ADHD tendencies, like difficulty regulating emotions or calming down, like trouble sleeping. So these scans can reveal why children don't actually grow out of early problems like colic and tantrums, but they grow into more serious conditions like anxiety and sensory processing disorders like ADHD and chronic illnesses as they age. Now, the insight scanning technology, it provides precise measurement and tracking of nervous system dysfunction. And that's not some label or diagnosis that we're going to have to fear. It's how we approach it is that these scans are showing us this is how intelligent this intelligent system is adapting based on its experiences and how it's interpreting its world. We see that, it isn't working as efficient and as easy as it could or should. So when we see that, it's very clear how we need to tackle caring for a child. And this allows us to create customized care plans that address the actual cause rather than just managing the signs with things like medications or endless therapies. We want to go deeper and address the root cause. And that's what the insight scans help us do. They are so powerful as they aim to look deeper at the root cause of what the body is doing and why. And as you know, it is so important to look deeper, especially when other avenues haven't given the full answer. So, if you want to learn more about these scans, click the link in our bio to dive even deeper into them. We would love to help. When we can measure what truly matters, the nervous system, it can help you put the pieces together and help your child with their health. That's all for this one. Thanks for watching. Have a blessed day.